So thanks for that awesome introduction, and thanks to the Price School and to the Sol Price Center for Social Innovation for having me down from Seattle. It's my first time at USC, and it's a pretty special community here. I've really enjoyed the time with faculty and students, and I look forward to having more opportunities to interact. I also want to thank the funders for this project, and also the Peterson and Ford Foundations, which didn't fund the book, but which have funded some of the kind of subsequent data work, which I'll show you today. I want to thank the nonprofits. You'll see this in a second. A lot of what you'll see is going to be kind of just descriptive census data and administrative data. But I spent, as part of this project, a lot of time with well over 100 executives of nonprofits in different study sites, including some of the suburbs of LA. And as you all know, nonprofit executive directors have a full dance card every day. And so the fact that they would give me hours of their time, and many hours, I was deeply appreciative of. And before I start, I also want to talk, just to say one remark that I think will help frame the work I do and who I am. I grew up especially in my early childhood, in a low-income family, and at different points growing up, we would have been eligible for safety net programs that exist today. They didn't exist when I was a kid, and I used to think that kind of certified me as a poverty scholar, as a poverty researcher. I used to think that kind of gave me the voice that I had. And I think over the course of my training as a grad student and over the course of my professional career, I've really come to realize that being a white male in society gives you a lot of privilege. A lot of privilege that you know and understand, and then privileges that you know are there, but you don't necessarily are aware of in your day-to-day experience as much as you should be. And that awareness of my privilege shapes the work I do, it shapes the questions I ask, it shapes the voices I try to elevate. And I think you'll see some of that come through today. Certainly it comes through in different parts of my projects than others. But I wanted to kind of have you understand that that's how I see this work, and how it shapes kind of who I am as a scholar, and also as someone who's trying to do work that matters to communities. As Gary said, I was part of the Seattle minimum wage study team. Really happy to talk about that. It was one of the most interesting projects that I've been part of, and I think we've learned a lot. Some of the more kind of labor market data, but also impacts on nonprofits. I do a lot of different stuff. Food security. I spent a lot of time thinking about nonprofit human service provision. Some historical stuff. What you'll see today is that this project kind of pulls from all these different pieces. It pulls from all these different threads. What I'll talk about today is kind of, first I'll start with some conversation about the conventional thinking about place and poverty, and more specifically the conventional thinking around place, race, and poverty. I call it the spatial discourse around poverty in the book. I'll talk about the implications of this, not just for our research, but for our safety net and human service provision in our communities. And then I'll walk through about how the changing geography of poverty exists in reality in contrast to these kind of narratives that we have, the kind of popular understandings we have about poverty. And then again, we'll talk more extensively about the implications of where poverty is today for the safety net. And then I'll talk a little bit about pathways ahead. Some of it will be about research. Some of it may be about the work we will do together or we'll do in our own career paths. And also, don't hesitate to ask questions. I was at the University of Chicago for a long time before I went to University of Washington, and so usually people in the audience would have their own PowerPoint slides that they wanted to present while you did your talk. So I'm very familiar with conversation. So I start the book by talking about the conventional thinking or the conventional discourse around place and poverty, and I think in the U.S. Poverty is largely viewed in our popular discourse, in our news coverage, as being an urban phenomenon. And if you go and look, and there's research that documents this, you'll find that urban settings are common images. Language of the urban is common in our stories around poverty. And also on top of this, we think of cities as being kind of places of non-normative behavior. Cities are poor places because people make bad decisions. People who live in cities are lazy. They have kids out of wedlock, whatever. And so we kind of map behavior onto urban poverty and poor residents of cities. By contrast, suburbs are kind of the places of affluence. They're the American dream personified. They're normative in that they symbolize work and family formation. And the images of suburbs in our popular discussion, in our popular culture, are kind of like this subdivision of single-family homes. But in the U.S., in our context, we also kind of link place and poverty to race. And so our explicit often our conversations about urban poverty are connected to communities of color. And often the kind of stereotypes and the notions of deservingness we have about poverty are tied to racial stereotypes and racial prejudice. And so these are kind of intimately linked. In the same way, suburban living is often linked to whiteness. It's linked to affluence and whiteness. And so these things exist and coexist in our popular narratives, our popular discussion, and they frame what I call, and I'm kind of doing this very quickly, but in the book I call this kind of the conventional spatial discourse around poverty. And so here, this is kind of a classic, kind of suburban white family image. And so in the book, I think about how these associations and stereotypes appear in our work, right? To kind of frame the project. And in many ways, we can think about how they shape our news coverage. We can think about how they shape our policy debates. This is how we see some of this discourse in our journal articles. So this is kind of a heuristic. And it's kind of just to kind of make us think and to have a visualization. But what you see here, these are the number of mentions of the words urban and poverty in the same article. Not in the same sentence, not in the same word back to back, but just in the same article, or city, or kind of different variations of this. This is the top line. And then these are JSTOR articles where suburb and poverty are mentioned in the same article. Again, not even in the same sentence, not even in the same paragraph. And what you see is there's virtually no mention in academic research of suburbs in our poverty research, and most of our poverty research, in one way or another, focuses on urban and maybe rural to some extent as well. But this is a dominant way we're trained to think. And actually, as someone who was trained as a poverty scholar, it's kind of how I was trained to think. Yes?
Is this studies in the U.S.?
These are just JSTOR articles, so it's kind of not super scientific. Yeah, I would, so like this is kind of like meant to say, but then ask questions like if you wanted to publish this in an article, you'd want to drill down. I would argue that most of the poverty research that you see in these kind of JSTOR articles is probably domestic U.S. poverty research, but it's a good question. Actually, I'm going to go back and try to figure that out. That's a good one. I appreciate that. But so this was kind of how I was trained. Actually, the germ for this book came. I was doing field work related to my first book, which Gary kind enough plugged. It doesn't have a hashtag because Twitter didn't exist when I wrote it. But I was doing follow-ups with surveys I had done with human service providers in LA, DC, and Chicago, and I went to a food bank, technically in LA County, but it was in a suburb. And the executive director was like, "Oh, I'm so glad to see you. We can't keep food on the shelves. We've got demand that has just gone through the roof in the last 2 years." And this was in 2006, early 2006. And it kind of challenged what I thought, because this is where the Brady Bunch lived in my mind, right? The suburb I was in. And so this book kind of comes out of actually being here in LA and seeing need manifest itself in places that don't conform to the conventional thinking. Here's another way conventional thinking comes in and emerges into our work. So this is a quote from a regional nonprofit executive director who was working in a Chicago suburb, and I was in her office, and she thinks of herself as a suburban service provider. The metro line that goes from the suburb to downtown is just a stone's throw from their office, and we were talking about the communities that they serve, and she starts pointing out the window, and she says, "This suburban municipality over here is urban. If you look at the education, it's definitely urban education in this suburban municipality. Urban education is having to spend probably a disproportionate amount of time looking at specific issues. One is dealing with poverty and the disadvantages that poverty brings to the community. People who are poor don't have money to do the extras. They don't have books. That goes hand in hand with the other issue, which I feel goes closely with urban education, which is lack of parent education." And what was really clear was she was pointing to a municipality that had a large African-American neighborhood within it. It was in a high poverty African-American neighborhood. But when I pressed her, I said, "But that's a suburb, right?" And she said, no, it's urban there. That's an urban place. And so she was talking about poverty in this suburban region as if it was urban. And it really kind of cemented this connection to me. Later on, I actually interviewed an executive director in the same area. And she was a black woman. And when she got the job, a board member said, "You should go look for a house in this municipality because that's where people who like urban things live." It's pervasive in how we think about our communities. And so we have to be able to balance some kind of different ideas. So first of all, it is true that poverty problems are more acute in cities, and they're more acute in communities of color in any geographic place. That's true, and we want to not lose sight of that. But this conventional discourse does a lot of things that I think matter in terms of how we come together to solve and address poverty problems. First, it overlooks substantial need and depth of poverty in all places. By thinking of poverty as urban, we don't look at poverty in other places. Or when we see it in other places, we think of it as urban. It's not of us. It's not of our community. And this promotes and reinforces biased understandings of poverty. Biased understandings that are not just about deservingness, but also about racism and about anti-immigrant sentiment. It fosters the notion that poverty is an experience that others have, not we have. It's something that other people have. And that means the responsibility for taking care of poverty is something that other people do. When we have poverty in our communities, it's not for us to tackle, it's for other people to tackle. And this is not just limited to suburban areas. This happens in affluent communities and cities as well. Ultimately, this discourse, however you think about it, does a lot to undermine public support for safety net investments because we associate race and place with poverty, and therefore those biases that we bring to the table as a society weaken support for the safety. And there's all kinds of evidence that when you start to frame low-income families around race and place, you start to get less support for safety net programs. I think also important for those of us in the innovation space, it fails to capture the complexity of doing this work and the complexity of doing this work in places. And so for all kinds of reasons, I want to challenge this conventional thinking as we try to talk about where poverty is located today, who's poor, and how the safety net responds to it. This is important framing for that conversation. So what you'll see in the talk is data from all kinds of things. I'm not going to spend too much time on it, but there's a lot of census data. I can talk about how I define suburbs if you want, but largely I follow the OMB, Office of Management and Budget definitions of metro areas and primary cities and suburbs. I'm happy to talk about that in Q&A. I have a county-level administrative database that has public program data, and I'll show you a few cuts of that. And then I don't have a ton of it, but I'll give you examples here or there. I spent a lot of time developing case studies or cases in suburban LA, DC, and Chicago. And actually in Chicago, I was at the University of Chicago. I volunteered in food pantries and other organizations as I kind of was embedded doing some of this work as I was kind of doing some R&D on the project. So this is a chart from the book that's been updated with more recent data. And it tracks the number of people living in poverty in the largest 100 metropolitan areas. And the purple line here, or the blue line, are the number of people living in the suburbs of our largest 100 metros. And the red line are the number of people living in the cities. And what you see here is in 2017, even though the kind of recovery is starting to show that some people are able to leave poverty, there are about 4 million more people in poverty in the suburbs of our cities than the cities of themselves. What you'll also notice is that this is not a new phenomenon. In fact, the tipping point happened nationally sometime in 2000. In Seattle, actually, there were more poor people in the suburbs of Seattle in the 70s. In Chicago, the tipping point happened in like 2005, 6 somewhere. So it happens in different places at different times. But if you go back to 1990, there are almost as many poor people in the suburbs of our largest 100 metros as in the cities themselves. And if we were to go back to grad school, which some of us were in grad school in the 90s, we would be reading The Urban Underclass, or we'd be talking about ghetto poverty neighborhoods. We'd be talking about poverty in cities, even though at the time there are almost as many poor people in suburbs. So it gives you a sense of the blind spot that this has had in our research. Now, it remains the case that poverty hasn't gone away in cities, right? Actually, if I could have given a talk just about this red line and how bad urban poverty has gotten in the last 25 years, and I could talk about how racially segregated that poverty is and how concentrated it is. So the fact that suburban poverty has increased, it hasn't changed the fact that poverty remains a persistent problem in cities and in rural communities. And thus, poverty rates remain about twice as high in cities as in suburbs. Now, this is for California. I did this to, a little local flavor here. I took the top 11 metros and mapped out the same chart. So these are the number of poor people living in suburbs in the top 11 metros in California, and the red line is urban. And you see here, actually, we'd probably have to go back sometime in the 80s where this wasn't true, but many cities in California suburbanized earlier, and there were lower income families in those communities from day one. This suggests also that these kind of cultural myths about suburbs as places of affluence are real myths. They were never homogenous by class or race. They were always diverse. We just didn't talk about it. What is true is that even though there are more poor people in suburbs than in cities, the poverty rates are lower, about half. So even in places where there are a large number of poor people, the poverty rates in many of those suburban communities only reach about 10 or 12%. And we want to be able to think about that because that matters. Because concentrated poverty is a different kind kind of forces us to think about a different set of questions. One of the things I argue in the book is that we don't spend enough time actually thinking about the numerics or the counts. Because if you're a public health provider or a school and you get an increase of 500 kids who are low income in a short period of time, that puts a big demand on resources. It creates a heavy burden for your organization. If you're thinking about kind of how families kind of find themselves in those communities, there can be a lot of challenges. And poverty rates don't necessarily capture that. And so I think the numeric changes help us think about the demand on the safety net, demand on community-based organizations, on communities of faith, in a way that the poverty rate would kind of smooth over, because poverty rates in these suburban communities are still in the 10, 12% range on average. Is that helpful? So to think about kind of the intersection of place, race, and poverty, it's a complicated story. And actually, it's more complicated with recent data. If you were to tell the story of suburban poverty using data from 10 years ago, it would be largely a majority non-Hispanic white. It's shifted as suburbs have continued to become more diverse, but also as people have become poor in place. So non-Hispanic whites are a near majority of poor people in suburbs. They're a majority of suburban residents. But in many suburban communities, the vast majority of the poor are non-Hispanic white, which kind of runs counter to some of our spatial discourse. It is the case, as we talked about, that Black and Hispanics compose about 2/3 of the urban poor. And the urban poor, particularly poor people of color, are segregated in the highest poverty neighborhoods. The reality, though, is even though poverty rates are lower on average in suburbs, the number of high poverty suburbs, if you use a 20% cutoff, has increased. And this is a growing reality for people across race and ethnicity. And I don't have the chart here, which is a miss. But if you were to kind of do a thought exercise, this chart could be the number of census tracts with a poverty rate over 20%. And the lines would be kind of adjusted differently because there's more high poverty tracts in cities. But you get this steady uptick in suburbs as well. And so even though poverty rates overall are lower on average in suburbs, concentrated poverty has become a much more prominent reality. And it's one that, like in cities, is often highly segregated by race and ethnicity. So that's kind of the census data preview, and I can talk more. And I think I have a few slides in my back pocket, and we have a whiteboard, so who knows. But I want to pivot to talk a little bit about the implications for the safety net, because this is a really important demographic story. It's really interesting maybe from a sociological perspective, but I argue that this matters because of the consequences for the safety net. These changes in the geography of poverty matter because it affects how we help, and in many ways how we think about innovation. So we know that poverty problems are present and persistent in all places. They affect people from all types of all race and ethnic groups and in all places. The safety net and the social impact sector, however, in many ways is inherently local. And what I argue in the book is that a lot of what we do has a local analog or a local delivery point. Only programs like the Earned Income Tax Credit, which is a federal program and delivered through the tax system, really doesn't have any local or state interaction. And even then, state and local governments and community organizations do outreach to try to get people to partake in and take up the EITC. But a lot of ways, what we do has a local component: food stamps or SNAP, human services, TANF, Medicaid. A lot of these, the way that those programs help people and the kinds of help you can get, the kinds of coverage or care you can get, varies from place to place. It's kind of highly contingent on local capacity, local resources, local political will. One of the realities is, because of how we've thought about poverty as an urban problem, a lot of our investments are predicated on poverty being concentrated in cities. And that makes sense, right? Higher rates of poverty in cities, racially segregated, persistent across generations. We want to think about how we can tackle that problem. But what this means is that suburban areas and rural areas where poverty problems have gotten much worse over the last 30 years have relatively less capacity because our investments have been targeted so intentionally at cities. And as I talk about in the book, different programs have different kinds of responsiveness to changes in the spatial contours of poverty. And I'm going to show you a little bit now about what that looks like. So I mentioned the Earned Income Tax Credit. This is one of our biggest cash transfer programs. It's about $70 billion, $80 billion a year that we provide to families mostly within 150% of poverty, but we reach some, it reaches families a little bit above that. It's run through the tax code. You get the same benefit based on your income and how your household is composed anywhere in the country. So if I'm here, if I'm in Seattle, if I'm in Mississippi, it doesn't matter, I'll get the same benefit. And you see this when you look at the median return by urban, suburban, and rural counties. It's almost identical. In fact, actually these bars make it look like there's a difference, but we're talking about $10, $11, $50. The EITC reaches everybody regardless of where they live, because of how it's delivered and funded. It doesn't require state and local governments to do much of anything. In fact, actually, states piggyback on the federal earned income tax credit often when they want to. So this is a program that's really responsive, as is SNAP or food stamps. And so this is a scatter plot. It's always dangerous to put scatter plots up sometimes, I think. But this down here is the change in the number of people with income within 150% of poverty from 2000 to 2010, and this is changes in the number of SNAP recipients. And what you see in urban and rural would be the same, is there's a really strong positive relationship. When need goes up, SNAP caseloads go up. It's not one-to-one, it's almost one-to-one. And it makes sense, right? The SNAP program, federally funded, largely regulated at the federal level. States and counties have some discretion, and so you do see some variation. It's not quite as a one-to-one relationship as the EITC is, but it's really responsive to need across the geographic landscape. It's a federally funded program. When we start to think about programs that require state funding or have state or local discretion, or programs that rely on private philanthropy, we start to see a lot more variation in the responsiveness of programs, or in the coverage of programs across geography. So what this is the median per low-income person nonprofit human service expenditure in 2015. And these are drawn from IRS 990 files. These data they're not perfect. There's, anybody who's worked with 990 data knows that we wouldn't bet Gary's paycheck on the point estimates. But I think they tell us something about service provision, and I think when we use them at the county level, I have more confidence than them. So here I have urban counties, suburban counties, and rural counties. And actually, I should say something here I skipped over in the transition to the safety net. I use counties as the unit of analysis for the safety net parts of the analysis, because counties are the administrative unit for anti-poverty program delivery largely. So you go to a county human service office, you go to a county welfare office. Many nonprofits define their catchment areas as counties. So it's a smart unit of analysis that way, even though I don't use it for the poverty work. What you see here nationally is the median, the typical urban county spends about $876 per low-income person on human services in 2015. So this captures everything you would think of. It captures housing assistance, food assistance, job training, mental health and substance abuse, domestic violence services. So it sounds like a lot of money, but when you start to think about all that work, it's not a lot of money per person, even in urban counties. By comparison, the typical suburban county spends about $128 a person, and the typical rural county, $45 a person. These are vast gaps in how we provide assistance through the human service sector. Now, California, not unlike the state of Washington, actually does put a lot of money into human services. It's one of the most generous states in that way. And so you see the same kind of distinctions between urban, suburban, and rural. They're just not as large. And in many ways, suburban counties and rural counties in the state of California do much better than the typical county nationally. Yeah?
You said housing is in that statistic.
I meant like emergency housing services. Yeah, sorry. So like kind of emergency housing. Yeah. Not HUD.
You're not covering that safety net.
These are just private nonprofit services. They have public funding behind them. So we spend about $150 billion a year on human services nationally, which if you think about it is a big number. It's more than the EITC, SNAP, and TANF combined, kind of three of the big programs that we think about. And about $100 billion of that comes from government sources, mostly federal, but somewhat state. Yeah, Dan.
Just a question. Riverside County.
Yep.
Is that suburban?
Well, so let's have a conversation about what a suburb is. So you could make an argument that Riverside and San Bernardino are urban. You could make an argument that Orange County is urban. You could also make an argument that they're suburban, right? And so part of the reality is in California, it doesn't matter really where I put them. They have less funding than LA County. They have less funding than counties up in San Francisco per capita. So the median here would drag down a little bit, and the median here would fall a little bit. Tweaking that doesn't matter too much in California, but it's actually a pretty important question. And what I actually define them as suburban in this analysis, for the very reason that when I go out to talk to community-based organizations, they are thinking about LA as the urban center, even though they are urban, but they talk about how we wish we had the access to philanthropy or county resources like they do in LA in the big urban center. And for many of them, they think of it as a periphery. When you talk to community-based organizations staff, they'll drive from Orange County to the Inland Empire to work and back. Especially on the eastern edges or the western edges of those counties, people are working in LA County and in the city. And so it's tricky. Actually, there's kind of two places in the country that make it hard to think about what a suburb and a city is. California is one of them, so like Anaheim, right? You have places like Santa Monica, which like they feel different, but they don't really feel different. It's complicated here. And then out east in older cities, so like Cambridge and Boston. Is Cambridge a suburb or is it a city? And you kind of grapple with that. In the book, I kind of lay out like rules for making adjudication on this. In the county piece, it can matter a little bit when you grapple with places like San Bernardino and Riverside. It doesn't change these results much because you have a national sample. But the poverty data I showed you back here, this doesn't matter. It doesn't matter. I could call Riverside an urban center or a suburban place. I could call Anaheim an urban place or a suburb, and it wouldn't matter. It doesn't change these overall large national trends because only a few places kind of occupy that fuzzy space. What I would say though is that how we define suburbs versus cities, there's not really an official definition, and so we should do it based on the questions we're asking. So here I use tract level definitions and municipal level definitions. So it's a little bit more precise. Because the county level safety net piece requires me to use a different unit of analysis, I define urban and suburban in a slightly different way. And so it's not as fine-grained, it's a little bit more rough and tumble. Yeah, in the back.
Hi, can you also define poverty, please? Like, I don't know how you're...
Sure, I should have done that. That's smart, thank you. Here, I use the federal poverty measure. So it's people who are in households that fall below the federal poverty threshold, which for a family of three is about $20,000, roughly. There's other ways to measure poverty. There's a supplemental poverty measure, which captures cost of living and out-of-pocket medical costs, and work expenses, and that's more accurate, we think, but we can't put that in space because of how they impute data and things like that. We just can't chart it the same way. So to kind of think about changes in place in poverty over time, you need to have the same measure over a sustained period, and the federal poverty measure, for all its problems, does that for us. Does that help?
Yeah, so you're saying like it's adjusted through time.
So the federal poverty measure is adjusted for inflation over time, and it's based on the number of adults and kids you have in your household, and it's set. So a family of three with a single adult and two kids is about $20,000 a year. Actually, to this point, one of the things I show in the book is an analysis of deep poverty. So families living on less than 50% of the federal poverty threshold, which is about, depending on what year you're looking at, somewhere between $8,000 and $10,000 a year. And there are way more people living in deep poverty in the suburbs of our cities than in the cities themselves. And that runs counter to a lot of what we think about extreme poverty. But deep poverty problems have become much more prevalent in suburbs over time, as have poverty problems. I'm glad you asked that question. It's good. That was good. There was another hand up. But Ben, did you have right here?
Is this difference due to the fact that services are concentrated in urban counties, like there's more number of companies?
Right.
Or is it due to resource allocation alone?
Right.
Or combination?
Yeah, so this is a good question. So one of the things that we want to think about is the differences across places. And so we know that poverty's been increasing in these suburban counties at a really fair clip. And actually, there's a lot of poverty in rural counties. And when part of the conversation is to look at how we deploy resources. And we don't do it the same. The differences between, then how do we explain it? And part of the difference is that historically, starting with the war on poverty, we've been targeting human service funding at cities. If you go back and read policy pronouncements about the war on poverty, it was like poverty is in cities and in remote rural places. And we didn't actually do a very good job of targeting resources at remote rural places, but we did a lot of work through a variety of programs to build community-based organizations in cities, to funnel program funding to those organizations over time. States often get involved, and that's why you see California do well comparatively. And then cities and philanthropy contribute. And so once you have governmental investment and you have a base of organizations, we were talking about this at breakfast actually, most of these organizations that we see in these columns, a lot of them start in 1965, 1970, 1975. Now there's organizations that come on over time, but the foundations were built then. And thus you channel capacity. And if you don't have nonprofits in your community, so actually one of the things that's striking is in a lot of these suburban and rural communities, there aren't nonprofits that register with the federal government. There may be nonprofits that have satellite offices, but it's not the same. So if you have weak nonprofit capacity, you're not able to compete for grants or contracts, or there may be only one provider for a 3-county region or something like that. And so a lot of what we see here is driven by investments made 50 years ago in a mindset that poverty is an urban problem. And really, we've just kind of proceeded to do that. We haven't rethought our allocation strategies. But the trick here is, I showed you on the chart before, urban poverty hasn't gone away, right? So we can't just take this bar and move it down here, right? We still have more poor people. We have higher poverty rates today than we had 30 years ago. So it isn't like we can reallocate our way out of this too. So when we think about changes, though, it's not static, right? So this is the change in the percentage change in the number of, the real dollar percentage change in nonprofit human service expenditures from 2000 to 2015. It's on the vertical axis. And the x-axis is the change in the number of low-income people in that time. And nationally, what you see is it's kind of a slight positive relationship, but there's almost no relationship here. It looks like a kind of a random array of points. Some counties that have lots of increases in need spend far less. Some spend a lot more. Some spend a lot more even though they've had a net decrease in the number of people with income near or below the poverty line. It just doesn't have a pattern. And actually, this would be a great dissertation for somebody to figure out why this is, right? Why do we see kind of a nonprofit sector that looks as if it's not responsive to need as it changes at all? And in some ways, it's because of the local capacity, the local will, the local resources that drive this. Those responses, because of how we often think about poverty, place, and race, aren't responsive. They're not immediately responsive to changes in poverty. So I put California on here, the purple dots for California counties, and actually the relationship is slightly negative. But again, basically what it suggests is that there's a weak relationship, if any, between changes in human service expenditures among nonprofits and need in counties. And if anything, what we think is what we could hope for is that this is just a lag effect. That in 10 or 15 or 20 years, when we come back, we'll have an anniversary. We'll have the social innovation 30th anniversary or something like that, and we would see that this line was different. We would see that suburban counties and human service providers caught up. At this point, we're not there. Yeah, Gary?
Scott, I get the sense that to date to this moment in the presentation, you haven't been suggesting that this is a good thing, that suburban poverty has gone up. But there are theoretical paradigms that actually would celebrate exactly what we're seeing so far. The simplest of those is the moving to opportunity, poverty deconcentration, and so forth. It might be something you want to address later, but it certainly strikes me that so far the data says, well, this is great news because now poverty is not as concentrated in the places it was, but you're giving us a little cautionary tale.
So it actually still is as concentrated in cities. So poverty rates in cities haven't gone down. They're still about 20%. The number of census tracts with poverty rates over 20 and 40% have increased in the last 20 years. The number of people living in poverty has increased by about 40% in the last 30 years. So poverty in cities hasn't gone away. Rural areas have kind of held stable, in part because there just isn't much population growth, and so poverty levels have stayed about the same in rural places. So one of the things we don't know, but I think matters here is we don't really know how much of this is driven by people becoming poor in place versus people moving to suburbs. That matters, right? And we know that people have been moving from rural communities to suburban communities for a long time. We know that people are moving from cities to suburbs for a long time. Those are historic kind of migration pathways. But when you look at the increases in suburban poverty over time, they're 2 to 3 times the population growth rate, which means it's people becoming poor in place or moving to suburbs and then losing their job and becoming poor in place. It's not as much about migration or mobility. Having said that, there's a lot more variation or heterogeneity in suburbs than there is in cities in terms of their composition. And so you can find places like on the south side of Chicago, inner ring suburbs, where there are more housing voucher recipients that have moved or people who used to live in the city who've moved out. But overall, that's not the driving factor. Most of this reflects changes in the structural economy. So suburbs have gone through the same kind of deindustrialization processes that William Julius Wilson's talked about in cities. And the way the labor market is today is it's very bimodal. You have a lot of good paying jobs and a lot of jobs that pay less than $15 an hour. And if you work full time in those jobs, you can't get to the poverty line. But as I was talking about with Sean earlier today, tax data or other data are necessary because our census data don't allow us to follow families closely over time. Our panels aren't really good for that. And you'd really need something that identifies people and their income in place, and you can link them over time to be able to understand that.
One is, have the nonprofit service providers trended in the same way in terms of their growth from the 1960s? Like there were maybe only 30 in an urban environment, now there's 600. And the second question is, does the fact that we age longer cause this trend to have a...
Yeah, all right, so these are smart questions. Okay, so let me do the age one first. So increases, you can find places, this is again the heterogeneity story, you can find places where the graying of the population is driving the rising numbers of people in poverty, where older Americans on fixed incomes and maybe less income than they anticipated are finding it harder to make a go of it, or they're outliving their savings, which is a reality in Florida and other places. So you can find places where that's a reality. It's not driving the national trends. And the increases in poverty among elder Americans and children are actually comparable across cities and suburbs. So it isn't, it's part of the story in some places, but it's not the big part. One of the bigger driving factors is that suburbs have become a destination for immigrants to the U.S., and particularly Latinx immigrants. And that matters because those families are working, but often working poor. And that in many places where that's a new phenomenon, that's been a driver of some of the poverty that we identify. But again, it's not the dominant factor driving it. The nonprofit data, my friends who study nonprofits will tell you that, hopefully, this is what I say at least, our nonprofit data before 2000 is not awesome from the 990 forms for 2 reasons. Well, 990 data is not awesome for lots of reasons, but one reason is before 2000, I don't know, I think there's kind of an oral law or oral tradition around how to use 990 data. But over the course of the 90s, when we started to have really good 990 data, not every nonprofit filed a form. And so you see more nonprofits over time in the 990 data, but it's hard to know how many of those are organizational births versus people just finally coming into compliance with federal law. And so I am hesitant to make any kind of assessments. And I haven't looked at the changes in the number of nonprofits per se. But this is great. Can I give you $20 for a super smart idea?
The reason why I ask is people will chase the dollars.
That's right.
So the more you provide, it's not, in other words, if you really want to be innovative, you try to figure out how to create innovation to drive the cost down, not keep causing expenses to go up. And again, it's just one of those things that you've got to figure out how to do that in a more innovative way.
Yeah, I see that actually, and I think one of the things, to your point too, that's happening here with the urban-suburban disparities is large urban regional nonprofits are going out into outlying areas and doing their work, and because of the way 990 data are, it looks like that is happening only in cities. But they're kind of out because they can compete for the grants and they can provide capacity and they have the kind of economies of scale to do it. So I'm thinking I have some good. I'll tell you some good stories maybe before the end, maybe if not afterwards. Yeah.
I want to go back to the issue of residential mobility versus becoming poorer in place. Have you thought about or already done an analysis that cuts Raj Chetty's data by either at the county level or tract level by the same taxonomy?
Yeah. So this is a good question. I'm working with a group of scholars, Paul Jargowski, Michael Stoll is at UCLA. A few of us are kind of have a little poverty in place working group, and we've been talking about doing that. And we're interested in it for a bunch of reasons. One, so Raj Chetty's taken tax data and kind of shown in a variety of different papers that where you grow up matters to your later life economic rural being and trajectories. You all probably know that, but he's probably been here to talk. But that data is based on the way that places used to be. And so one of the conversations that we want to have with the data is, are the places that are mobility and opportunity areas in those data, which are really from the 80s and 90s, are those still places that would have opportunity today? Because actually in my data, a lot of the places that you would have moved to in 1990 have seen poverty double or triple since. And it's not, again, not just about mobility, it's about the labor market opportunities in those places. So in Seattle, they're taking the Chetty data and they're trying to tweak it and update it to kind of capture what's happened in the local labor market and in housing prices so that they can try to think about encouraging voucher recipients and then affordable housing construction in real opportunity zones as opposed to maybe the time machine opportunity zones. But what's really important about Chetty's work is he's giving us all kinds of ways to think about how place and poverty matter and about pathways to mobility. There's still a lot of black boxes, if you will, in that, but it's super important work in that way. All right, so I don't know if I have good news. Let's see. So how do we explain the differences by place? I've talked about these a little bit. So part of the differences in human service provision, which is the example I gave about how the kind of localized safety nets aren't responsive to poverty, a lot of that is about limited capacity and funds and about the fact that in many communities outside of cities, there's just not the public or private capacity to act. Some of it in suburbs is about fragmentation and distance. I spent time with a food bank in suburban Chicago, and the executive director, almost in an exasperated way, talked about the 267 municipalities and school districts that she had to interact with. And when you think about that, that's hard work, right? And the distance she had to travel in that region was vast. Getting food to places was really a difficult challenge. And so in many suburban places, fragmentation of institutions makes it difficult to do the work, and distance makes it hard for providers to have economies of scale or for clients to get to programs. There's a lot of NIMBYism that's present too. I had in another field site, I was interviewing a school principal, and she was talking about how they had this really successful food pantry in the school, and that successful in that it was meeting need, and to use it in that way. And they would have a line of families that would come on the day the pantry was open, and they would get food, and they felt it was helpful for the kids to make sure that they had enough to eat, and they had summer backpack programs and all kinds of things like that. And one day, somebody from the county council came to the school and saw this line of people out the door, and it was like, what's going on here? And she's like, oh, this is our food pantry. People are really, he's like, we can't have this. We can't have these people in our school. We can't give this impression that these people are here. And she's like, these are the kids from our school. These are the families of our school district. But this person didn't see it that way, this county council member. And instead, he started talking about like property values. We can't have this, people, and he kind of went off on a rant. And so there's this sense that there's also pressure to not provide help or services, in part because poverty is a problem for others, from urban places. It's also because we're worried about what it is going to mean to have poverty problems for home values. And so one of my colleagues, Alex Murphy, who's a sociologist at Michigan, she's going to have a book come out in the next year or so that's an ethnography of a poor black suburb outside of Pittsburgh. And when she started to do her work, people in the community were really worried that they were going to get named in the book because they were worried it was going to affect their ability to sell their houses. And that's real, right? That's real. There are all kinds of perception gaps. I spent time with a nonprofit that worked with kids in a suburb outside of Chicago, and it was an interesting juxtaposition. It was kind of a low-income community next to a gated high-income community, akin to kind of where Ferris Bueller's Day Off was filmed. If you that's a reference that anybody remembers. And she went to the high school and said, I really would love to have some student learning projects. Can you come and have students will volunteer and work with some of the little kids in our community? And the principal's like, oh, we don't have poverty in our community. Our kids do their service learning in Appalachia. And in many of the subdivisions in this lower income suburb, the poverty rates would have been over 30 or 40% comparable to what you'd have in Appalachia. So we just don't think about it. And it changes how we think about our work. And then it's just hard to overstate how profound discrimination by race and ethnicity matters. I went to do an interview with a workforce development nonprofit that specialized in services for Spanish-speaking adults. Primary language is Spanish, and many of them are immigrants to the U.S. Relatively recent, but some have lived in the U.S. longer. And I got to the place, and all the signage on the outside, it kind of covered the windows, kind of ceiling to floor. It was signage of white folks like me, like sitting at computer terminals and stuff. And I'm like, that's weird. But check your privilege. Let's go inside. And then it's clear. All the staff are fluent Spanish speakers or Spanish first language staff, and the clients are all Latino immigrants to the U.S. and they're looking for jobs and filling out resumes and doing GED stuff, and it's great. So I'm interviewing her, and I said, "Can I just ask you why your signage kind of feels really different than what's going on the inside?" And she said, "Well, if the county knew that we were working with Latinos, they would defund us." And then she goes on and talks about another organization where they got picketed and they got defunded and they had to close their doors. And so she kind of went on the down low, essentially, is what she said. It's hard enough to serve communities of color if we could be open about race and ethnicity and about inequality. It's impossible to do it if we have to keep it on the down low in the way that she did. And that explains partly why we don't have resources in different places. So what is working? Here we go, good news. The Gary Painter good news. First of all, I think the places that have done better at building local capacity to tackle poverty, and this is true in cities and in suburbs and in rural places, have worked really hard to build awareness around state and local elected officials and engaged people intentionally. And the payoff isn't immediate. It's an expensive and often a difficult set of activities to pull off. But I found when I would do interviews with local elected officials in particular, many of them had no grasp of the poverty problems in their community. The congressional staff didn't really understand often the depth of poverty in their districts. And building that awareness is important as you kind of make claims for additional funding or as you try to get an allocation of the community development block grant or what have you. And so places that did that were better. But this also requires local elected officials to care and to want to do that learning. Places expanded public investments and also were able to cultivate more private philanthropy. And some of it was just getting donors in the community to realize that in addition to giving to city causes, they should be giving to causes in their communities outside. Success also was in places that really emphasized culturally competent practice. I talked about the workforce program that was on the down low. I spent time in another human service organization that worked with Latinx populations, and they had a real tight working relationship with the city government and with the police force and with other local agencies, and everybody was supportive of that group. And they were able to do a lot of really great work for Latino immigrants in that community that you couldn't have done in many other places. But it was in part because everybody supported not only the community, but also culturally competent practice. In many suburbs, communities of faith are the most trusted organizations. This is true in cities and in rural places as well. And so a lot of suburbs and places outside of cities that were doing well were tapping into communities of faith. And again, I was talking, I think it was Sean, or was I talking with you about this today? There's this large multi-site congregation outside of Chicago that I visited, and they crowdsourced about $6 million, $7 million to build a new facility, and it's like this building. It's really nice. And people go and they get help with a car repair, or there's a food pantry or food bank that looks like a grocery store, and there's a clothes closet and some employment services. There's an eye doctor certain times of the week. People come dressed up, and they're treated with dignity. They're treated with respect. The facility is qualitatively different than most public agency offices you'll go into, and it's been a pathway for families to get connected up on public assistance programs that they're eligible for but weren't applying for. And this was particularly true for families who hadn't known poverty before, had maybe been affected by the recession or a job loss or a sick spouse. And these communities of faith were really critical. We don't often like to talk about that in poverty research, but our congregations are key allies in the fight against poverty and inequality. Actually, I was telling Sean, I'm having like an absent-minded professor, so I think it's called Willow Creek, but I don't want to. Actually, so it's interesting. So I went back right before I moved to Seattle, and they had such a surge in demand for help that they had to kind of treat. They had to work with families. They had to work with families in two chunks, the morning and afternoon slots. They had to limit the number of people that they could work with. It kind of exceeded their initial plans because the volunteers were burning out, and they couldn't keep up. And so they had to make this heartbreaking decision about limiting the number of people, and then they also had to kind of narrow the geographic catchment area around the facility.
Sounds right.
Well, there is a Willow Creek church in Chicago.
Yeah, I think that's right. It's really an amazing place. Actually, I don't think they like it when I tell people who they are, because they saw this as their work, but they didn't want to be known for it out of kind of humility. They didn't say that wasn't their mission. And so, we have to think about these organizations for the priorities and values that they have. So what is our work? And so there's a lot of things. For me, I think it's about challenging stereotypes about poverty and its causes, and that's work we all should be doing. It's advocating for more and more consistent federal funding. We're not going to reallocate our way out of these issues. We need more dollars. I did a gap analysis. We need about $25 billion in new human service funding to close the gap between suburbs and rural areas and cities, which actually sounds like a lot, but it's about a quarter of the tax cut we just passed in 2017. So, we could just have a little bit less of a tax cut. I think a lot about how I can do my work better on data and translation. This is the piece, though, Edward, I think you're talking about. The places that I think had the most promise for doing better for their communities were places that were training the next generation of leaders, investing in their skills around budgeting, management, finances, evaluation, but also investing in indigenous leaders, if you will. Young leaders from communities of color often that not only could do the professional work, but also understood the community's needs and could interface with communities in a more authentic way than if I was the executive director, I guess. And I think that's a piece that we can't overlook. And that's actually why programs like this, the things that we're doing at the Evans School up at Washington, are so important, trying to kind of find the next generation leaders, and whether it's through our executive ed programs, community engagement activities around data, thinking about making opportunities through scholarships and fellowships available to students from non-traditional or marginalized backgrounds. This is huge. And there's a lot of work that philanthropy can do too. In Chicago, they had a Latino policy forum that trained up local Latino leaders from nonprofits. And you can find examples of that all over. In Seattle, we have Seattle Works, which one of my friends, Ben, runs, and they have the same mission around getting not only helping nonprofits hire with equity and inclusion in mind and better training, but also helping people from underrepresented groups serve on boards and help shape board work too. Even if we are able successfully to generate new revenue sources. If we refract those revenue sources through the systems that we have in place now, we're not necessarily going to change the allocation or balance of resources available. And so thinking about not only creating new organizations, but also training leaders and helping leaders connect to funders and other resources really matters if we're going to change the playing field in a dramatic way. Because we could easily spend more money and just replicate the kind of inequalities that we have. I think ultimately let me just say, ultimately what I argue though too is we can't just, it's not just about us thinking about money or training. We also have to see that poverty is a problem that all our communities experience. It's relevant and present in all areas of our country. It affects all our families and friends and neighbors, regardless of race or ethnicity. And if we don't see poverty as a problem that affects all of us, one way or another, we're not going to be successful at addressing poverty in any one place. I think economies of scale issues are tricky because it depends on the place and on the nature of the provider and the services. And so that's really hard, and it's easier to tackle that with an injection of resources in some settings than others. Let me give you kind of two thoughts. One, what I show here and in subsequent work is that federally funded and regulated programs that are kind of like EITC and SNAP, those are the most responsive and they're the most present across geography. And so if we're really serious about tackling inequality between different places, it's not actually doing more locally, it's actually doing more at the federal level, ironically. That actually is the best path to having greater equality in terms of the availability of assistance and services. And so thinking about ways to try to not only inject more resources, but ensure that there's more predictable and consistent service provision across places matters, whether it's Medicaid or human services or what have you. That's one thing. And so that's like one of those things that's super easy to say, and then like when you start to think about how you do it, it's harder. But you could think about how you would expand funding mechanisms for the Community Development Block Grant or the Social Services Block Grant. You could think about different ways of doing Medicaid that would allow you to kind of push for better capacity. I think the other thing I would say is I'm also kind of okay with thinking about supporting local nonprofits and trying to build nonprofit capacity in places through local strategies, because local nonprofits aren't just, in human services, they're not just delivery mechanisms for assistance. They are key actors in civil society, so they provide voices for underrepresented communities. They're advocates. They help people engage in civic activities as volunteers or as donors that matter. And so having stronger nonprofits in places and investing in nonprofits isn't just about helping people get assistance. It's actually about building healthier and stronger communities and improving the representation of particularly marginalized members of our communities in governance and nonprofit work. I think the way that we still talk about suburban poverty and the way that communities still act is as if it's an othering problem. It's not an us, it's a them. And suburbs are really segregated. I mean, you can, when you go to different suburban places, you can find these pockets of poverty. They're really isolated and segregated, and so our land use patterns really reinforce those kind of notions too. I also think to the extent that suburbs continue to become more diverse, if leadership in organizations and in government doesn't change to reflect that diversity, you're going to also have kind of race and ethnic, prejudice along race and ethnic lines continue to inform how we help. In one of the regions I was in, the housing authorities came together and did an audit study of discrimination in housing rental applications, and they found patterns that people of color, when they would go to apply for, try to rent a house or rent an apartment or something, didn't get the same call back as people as non-Hispanic white folks. And there was this conversation about housing discrimination along racial lines in that community, and a whole bunch of municipalities came together. They didn't want this to come out. They fired the person who wrote it, and then their internal justification was, well, one of our mayors is a person of color, and he says there's no discrimination. And so even I think the barriers, the political barriers and the perception barriers, and then our race and attitudes and attitudes about immigration are such high hurdles to get over that I think the geography of poverty, the shifting geography of poverty alone isn't going to be enough to get people to say, oh, we got to get in on this and help. I think we have to have different conversations and challenge the power dynamics that I think are present in many communities.
Well, I guess I'm just curious, so if people begin to recognize this distinction between urban and suburban poverty, is it then possible that people would say the suburban poor are more deserving?
Oh, I get, yeah. Well, yeah, so in some of my communities that I was in, they talked about the new poor, and those are white people who just lost their job, right? And so there is that element to it, and I think to the extent that places start to identify poverty in their communities, it is often picking more deserving populations or thinking about kids and doing things for kids as opposed to for their parents. So I think I talk about it, but I don't think I kind of test this in any kind of real way. But I think that's present for sure. So I would say first, I think it's important for us as we develop poverty solutions to think about the communities who have historically been marginalized and isolated from opportunity or from kind of full engagement in society. And so I don't think I make that case in the book, but I think normally that's where I would come out. I think what I try to do when I speak to community groups is to emphasize that poverty's increased across, if we just focus on, well, I don't have it here, but we could focus on Asian Americans or Asian immigrants, Latinx communities, Black Americans, and non-Hispanic whites. And poverty's increased, roughly doubled in suburbs for all those groups over time. It's a little bit higher for Latinos, a little bit lower for African Americans, but it depends again on where you are. So I think poverty is increasing across all these groups, but our communities are also becoming diverse in all kinds of ways. So the population's composed differently in suburbs now too. So my kind of argument is we need to be helping everybody, and we need to be paying attention to communities who are historically marginalized. Sometimes that means providing assistance, but oftentimes it means providing access to in many of the communities that are almost majority Latino in outside of Chicago, there's no representation on any elected board by a person. They're mostly Mexican Americans or Mexican immigrants in those communities. No representation at all on elected officials. And so, I feel like part of it is we got to tackle poverty for everybody everywhere. And if we think about in that way, maybe it's a cop out on the race issue. It's kind of making like a universal argument. But I think we need to attend to housing discrimination, labor market discrimination, gaps in power and access to philanthropy that I think have been pervasive, particularly in communities of color which have been marginalized. So I feel like I kind of maybe want to have my cake and eat it too, I guess. I feel like you have to have both. But I feel like when I go out and talk to suburban leadership groups, I just say poverty rates are higher among communities of color, but there are a lot more poor white people in our community, and we have to help everybody. We can't just pick and choose who we help. And that's kind of the message I give out.